Take our lead, let's help you make your mark. Our goal is your satisfaction. Let us show you the way.
Cauliflower ear is the result of a direct blow to the outer ear. Blood or other fluids fill the space in between and disrupts normal blood flow. The skin on the surface of the ear is the only blood supply for the cartilage. Without adequate blood flow, the cartilage is starved of vital nutrients.
Make your mark, take our lead.
Ultimately, the cartilage dies and the risk of infection is increased. Untreated, the ear cartilage contracts on itself, forming a shriveled-up outer ear, known as the cauliflower ear deformity. Once cartilage death and scarring, fibrosis, occurs, the resulting deformity is generally permanent.
Make your mark, take our lead.
The components of the ear involved in cauliflower ear are the outer skin, the perichondrium, and the cartilage. The outer ear skin is tightly adherent to the perichondrium because there is almost no subcutaneous fat on the anterior of the ear.
Thank you for watching. Please subscribe and hit the bell notification.